Hi, and welcome back to another training video for FairPath. Today we're going to be covering the billing queue and the billing log. These are specifically designed to help a practice and provider's billing team know exactly what CPT codes to bill for each cycle and what billable codes go with what patients. So here we are in our test practice intelligence factory. And if I go to the left side here, you'll see all of the clinical navigation, the dashboard, priority queue, patient imports, providers, devices. Right after that, you have the billing queue and billing log. So when I click the billing queue, we see two billable codes that populate here. They're both under test patients. The bar at the top is sortable, so I can select the specific CPT codes that I want to prioritize and capture. And I can also download a complete activity report here, 7 days, 30 days, 90 days, or month to date. And when I hit generate report, it's going to export as a separate file. That file is going to contain all of the documented information you need to be able to bill each code correctly, including start and stop date for date of service. Now, what makes this great is as a patient, if I click on the left side here, as a patient is being worked on clinically, these progress bars are filling up throughout the date of service period, whether that's monthly or every 30 days. As these CPT codes are filled up or captured, those progress bars, once full, will immediately populate inside of the billing queue. You'll notice that we have a G code, that's APCM, that is filled in blue. This means that this code is ready to be billed, and any blue bubbles with codes that aren't filled in still require more time to elapse before you would want to bill these codes. Now, billing codes can age. So I'm going to switch over to a different screen here and show you a bad billing queue, right? So here's a bunch of red and yellows. These patients have had billable codes just kind of stacking up repeatedly. Now, if we click into each one of these, we'll be able to see that the red billable codes are in danger of aging, and the yellow ones are outside of the normal billable event range. So blue is ready, yellow is be careful, you'll probably want to bill it soon, and then red means please bill this before it ages out. Now, clicking back over to our Intelligence Factory test patients here, if I click on the patient that has the billable code ready, when I click into that patient, you're going to see some overview demographics for this patient. This allows for the biller to be able to see what type of insurance information is being captured here for this patient. As we scroll down, you'll notice that the monthly progress bar here that's being tracked is front and center. As you scroll down, the ready to claim or ready to submit for claims, when you check this box, you can mark it as billed. Now, once you've marked it as billed, that means you've submitted it through whatever your billing channels are. Now, you'll notice that now it's not showing anymore here, and that's because inside of the billing log here on the left, when I click into the billing log, you'll see that we had an action date of July 2nd, which is today, and it's for that specific G code that we just submitted for payment. Now, this allows us to keep a patient billing log. This log is running constantly. So all of the information is saved, all of the information is on file, and you can always send it back if you accidentally make a mistake, and then it'll be set up for you for your next billable cycle here. So again, click the action button, mark as billed, and remove from the billing queue. Successfully updated. The billing log will receive it, and you've successfully moved a claim through the billing queue. So this has been an overview of exactly how the billable codes work inside of FairPath. As those codes are captured inside of the clinical portion of our portal, FairPath actually will show you in the billing queue every one of those captured events placed in a nice and easy format for you to know exactly who to bill, when to bill it, and how to prioritize your work. Again, this is safe, explainable, understandable, and it's also auditable at all times. This has been an overview of the billing queue. Thank you very much, and we'll see you in the next video.